Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
We are fortunate, Tracy, to have back in our studio one of our favorite infectious disease specialists and one of the world's vaccine experts, Dr. Greg Poland. And you know, he's got a lot to talk to us about.
Usually does.
Including why we need a Lyme disease vaccine and how to protect yourself this summer.
An update on the measles outbreak as we head into the new school year as well.
A progress report on a universal flu vaccine.
His take on the new guidelines for the HPV vaccine. And finally, changes to the list of vaccines recommended for adults. Welcome back to the program, Dr. Boland.
Fun to be here with you.
I love it.
It's nice to have you. So, all right, let's start with Lyme disease. Is it true that you can protect your dog against Lyme disease, but you can't protect yourself or your children with a vaccine?
True.
Now, how can that be?
Isn't it surprising? So we have had an explosion of Lyme disease. It's the most common tick-borne illness in the U.S. It is said that we have 30,000. We probably have 300,000 new cases a year.
Is that
right? There is a vaccine, as you mentioned, for dogs. There used to be one for humans, but it was withdrawn in about 2002.
Wait a minute. Why is that?
Due to class action lawsuits and a lot of misperceptions.
Class action lawsuits.
Yeah.
I mean, there were certain individuals who thought it caused
arthritis.
Really?
Yes.
Not true.
Not true.
So are you working on another one?
I'm not, but there are companies that are working on Lyme vaccine, in fact, now in clinical trials. And the interesting thing about the new vaccine that's being developed is it will probably protect against the types that cause Lyme disease in the U.S. and Europe. The one we had only protected against U.S.-based cases, not the European serotypes of the Lyme disease.
A third of a million cases of Lyme disease in the U.S. every year?
Yeah.
Tick-borne.
Tick-borne.
And could Lyme disease change like the flu vaccine? We have to get a different one every year because the flu changes.
No, the only thing that really has changed is some of the new tick vectors that can carry it. In fact, back a couple of years ago, there was a new tick discovered that can carry Lyme disease, and it is named after the Mayo Clinic.
All right, so no vaccine. So how do you protect yourself?
Well, the only thing you really can do at this point is to recognize that when you are in brush, high grass, etc., you are at risk for Lyme disease. If you have a dog or a cat that goes outside and then comes inside, you're at risk for Lyme disease. So you need to check yourself for ticks. Ideally, you tuck your pants into your socks, you put permethrin on your clothing, you put DEET on you, and as I say, when you come back in, you check for ticks.
Permethrin, so make sure
permethrin
on your clothing and DEET on yourself.
Yeah, yeah.
Okay, and that'll prevent the
DEET
stick.
containing, protect against mosquito bites, tick bites, etc. That's really all you can do. They are, when used strictly, they're pretty effective. The problem is nobody uses them correctly, strictly, and always.
Once you get Lyme disease, can you get it again, or is it just like another disease, then you're immune from ever getting it again?
Yeah, that's a good question. There's lots of controversy around that. But yes, I believe that you can be infected again.
So you don't get immune.
I do. I have a friend who was a great blood donor type of a guy.
Yeah.
And once he had Lyme disease, he could never go and donate blood again.
Yeah.
And so that made me think that once you have Lyme disease, it's in your system for good.
That's not true. And let me just qualify my answer. The reason you can get more than one case of Lyme disease, so to speak, is because there are different serotypes. So again, the type we tend to see in the U.S. is different than what we see in Europe. So there would be an example of where you can be reinfected.
If you find a tick, it's important to get it off as soon as possible?
Absolutely.
Because the longer it's there, the more likely it could infect you?
It's about 24 plus hours before that tick, when it goes to feed, regurgitates into your skin, and that's where this little bug gets into you.
I love this conversation.
Yeah, and so if the tick is fat, that means that he's already gotten some blood.
He's had a blood meal from you.
He might have regurgitated.
Yes.
And how do you get the tick off? What's the best way?
Just pull it off. You can take a tweezers and you can pull it off. You don't want to. I see people do things like take a match or a lighter and try to burn it off, or that they're going to touch the tick and it will release. And
That's old school.
you're going to hurt yourself more than the tick.
Well, and Dr. Bobby Pritt has been on, and she said sometimes when you do that, that is when the tick will regurgitate.
it could
And so by
very
doing
well.
something like that, you could be doing the wrong thing.
Right. You just want to pull it off.
Tweezers.
And about 70% of people who get those tick bites will have this bullseye rash, but 30% won't. But certainly if you see that rash, you get in for treatment right away.
And what are other symptoms besides rash?
They're pretty vague in the beginning. You can have aches and pains, low-grade fever. Later, you can have neurologic problems, nerve palsies, cardiac problems. So
if it goes untreated.
Untreated, right.
And how do they make the diagnosis?
By blood.
So there is a good blood test
there are diagnostic
for Lyme
tests
disease?
that are done. You have to be careful, and Bobby, I'm sure, would have talked about this. There are ELISA tests, and there are so-called Western blot tests, and you really need to do that confirmatory test because you can get false positives.
Doesn't it, the false positive thing, it seems like a few years ago at least, when I had some friends who would go in, they'd be like, oh, it tested negative for Lyme, but then later tested again because they couldn't figure out what was going on, and then it was positive. Does it test negative in the beginning sometimes?
That probably is a scenario where they were just tested too early, so to speak.
Well, and also, aren't we getting better at discovering, at diagnosing it?
I would say that's probably true, but you have to think of it in order to order the test.
Yes, I guess that's what I mean.
Yeah.
It's not top of
Now,
mind.
it's easy if you see the rash,
Right.
the
Sure.
classic rash, but
And then the treatment is relatively straightforward, antibiotics, right?
in fact, oral antibiotics if you catch it early, as opposed to later when you have the complications of Lyme disease, treating it with IV antibiotics.
Any particular antibiotic or just any broad spectrum?
Doxycycline is an easily tolerated antibiotic that we use for both prophylactic and early treatment.
Prophylactic.
Yeah. So in other words, there are people who we know who are at high risk, who have had bites, and we take the ticks off and treat them with a dose of doxycycline.
For 7 to 10 days, something like that? All right. Okay, there you go. That's Lyme disease. All right, now let's talk about vaccines for adults, because I know the CDC makes new recommendations every year. What's new this year?
In terms of adult immunization?
Adults,
so
yeah.
one is that the nasal spray influenza vaccine is back and available up to age 49. They had some manufacturing problems, and CDC didn't recommend it in the prior couple of years. Now that's available. We've talked about Shingrix, a new 2-dose vaccine against shingles. There is a new hepatitis B vaccine available for adults. Only takes 2 doses, not 3 doses, and exceptionally high levels of immunity. I would say that the other thing that has changed has been something that physicians will be comfortable with, and that's the idea of what's called shared decision making. So for the non-immunocompromised person over the age of 65, rather than routinely stating that they need the PCV13 pneumonia vaccine, we engage in shared decision-making to see if that is worthwhile in that particular patient. Everybody gets the polysaccharide vaccine, the so-called PPSV23, at age 65 or prior to that if they have risk factors. And the usual recommendation has been after getting PPS, that you start with PCV13 and then a PPSV23. Now that PCV13 is optional if you're not immunocompromised.
And this is particularly important, these vaccines, for older individuals,
Absolutely.
seasoned citizens, because their immune system weakens as we get older?
It's called immunosenescence, and it's basically kind of a slow degradation of the immune system. Believe it or not, that starts in your 20s.
Oh, well, even you're affected,
Yeah.
Tracy. I thought you were free and clear.
I knew it.
By the time you're into your 60s and above, it's certain that your immune system is not responding the way it did when you were younger, and we got to protect those folks.
How can I keep track of all of this? It's a lot of, you just said it's an update.
Yeah.
And then just keeping track of where you're at with your vaccinations.
So I've got 2 suggestions in
Okay.
that. Number one is when you see your healthcare provider, one simple question: are there any vaccines or updates that I need? Number 2 is go and check yourself. You can check at the Mayo Clinic website, you can check at cdc.gov, and you can actually see the adult, adolescent, and childhood immunization schedule.
All right, perfect. Well, everybody should do it.
Absolutely.
Infectious disease specialist and a world authority on vaccines, Dr. Greg Poland. Time for a short break. When we come back, we'll still cover HPV vaccine, some new updated information about that, progress on a universal flu vaccine, and a measles update as we go into the school year. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
We are speaking with infectious disease specialist and vaccine expert, Dr. Greg Poland. We've covered adult vaccinations. We've covered Lyme disease. And now let's talk about HPV vaccine because there are some new recommendations. But first of all, tell us what that is and what diseases we're trying to prevent.
Yeah, this one, if you ever could use the term silent epidemic, HPV would be it. HPV is human papillomavirus. Everybody in the U.S. will get infected with this. Everybody will get infected with it. Most all of us resolve that infection depending on which types we get infected with. But if we get infected with the type that causes genital warts, we have no cure for that. And if you get infected with the types that cause cancer, we don't have a cure for that. But we have a vaccine that prevents it.
A cancer vaccine.
Exactly. So genital warts, and these warts can also show up in your pharynx, right?
Absolutely.
In your throat.
Absolutely.
It can cause cancer of the cervix in women, cancer of the penis in men, cancer of the vulva in women, and cancer of the throat in both men and women.
Almost all the oral cancers are caused by HPV, and the majority of the anal cancers are caused by HPV.
Anal cancers. I forgot that one. Why would you not get this vaccine?
I cannot answer that question.
Well, tell me then, why do patients say, I'm not sure about this vaccine?
Especially parents, because it's recommended early on for kids,
So the recommendation is you can start as early as age 9. We typically do it around 11, 12, something around there, up to age 26. What's new is because of the explosion in this, 25% of Americans have genital warts. 25%.
Of American adults, men and women.
Yes. And so because of this explosion, because of the unfortunate increase in divorce rates and people in their 30s and 40s kind of getting back into the dating scene and a lot of promiscuity and other issues surrounding this, you now have this explosion in HPV infection. So the recommendation has been to expand the age range up to age 45.
Yeah, because when I first heard about it, it was the idea that you would give it to children, preteens, before they become sexually active.
Yes.
So now if you're up to 45 years old, conceivably you are already sexually active at that point, but it's still as beneficial to get the vaccine.
Yes, because either hopefully you have not yet been infected with one of these bad types, or you've only been in. So let's take the scenario, recent case I had, of a young woman who comes in and she has genital warts. She's been infected. All we can do is laser those, particularly the ones in the throat. There is no cure for it.
You laser the ones in the throat?
You laser
and
them.
in the genital region?
No, you treat those with a substance that we then shine a light on, and we do some different things like that.
And you actually have clinics where these people come periodically to get rid of these warts. Because once you got them, they just keep coming back, right?
That's right.
Oh.
Rare is the person that ever resolves those.
The young woman.
Yeah, so what we did with her is said, well, you've been infected with the type that causes genital warts, but we don't have any indication, because we do pap smears and we test, that you've been infected with the kind that causes cervical cancer. So it's still worthwhile to immunize that person.
Wow.
Yeah, unbelievable.
That affects a lot of people.
Yeah.
I am just absolutely flabbergasted. 25% of American adults have warts, genital warts.
Yeah.
Ooh, that's a busy clinic.
Yeah.
All right, finally, let's get a measles update as we head into the new school year. It's been a bad year, hasn't it?
It has. Tom, this is just mind-blowing. We have more cases of measles in the U.S. than we have had in the last 30 years, back to 1992. In 2000, measles was declared eliminated in America, and we are almost back to where we started for one reason: people who are unvaccinated. Why are they unvaccinated? Primarily because of misinformation, false information about this bizarre idea that measles vaccine causes autism.
Fear.
It's simply not true. Yeah.
It's the fear of
Fear
it.
turns out to be pretty contagious.
So what happens is people travel overseas where people are not vaccinated. They get measles and they come back here and infect the people who haven't been vaccinated, right?
That's been one way. Another way has been among Orthodox Jewish communities where they haven't been educated or exposed to it. Once they are, they're pretty compliant with it. But you're exactly right. All it takes, because remember, this is the most contagious disease we know of. Okay?
So if you're exposed to it, about 90% of the time you get it, right?
You get
I mean,
it.
that's how
If
virulent it is.
somebody with measles had been in this room 8 hours ago and we were unvaccinated and walked in here, 90% of us would get that infection.
Do I need to get a measles booster? Or once you get a measles vaccination, are you set?
Well, yeah. I mean, the recommendation is that people get 2 doses. There is a small failure rate of 1 dose, and that's the reason for 2.
And, you know, this is not a benign disease,
No,
right?
One out of 1,000 people get infected are going to develop encephalitis. 3 out of 1,000 are going to die.
That's one of
encephalitis, infection of the brain, the lining of the brain.
That's one of the other mistakes or misinformation that people have been taking is, oh, well, if you do get measles, you can take antibiotics and you'll be fine.
No, there is no treatment for measles.
All right, finally, universal flu vaccine. Give us an update on that
this is really exciting. So,
Hold on just a second. Universal flu vaccine.
This really is exciting. I mean, can you think of a virus that every year causes more misery? Last year, we had 90,000 Americans die, almost 1 million be hospitalized as a result of flu. And we're always playing catch up, right? We decide what should be in the vaccine by looking backwards. And by the time we get to the year, that virus is already starting to mutate. So in various years, we have decreased efficacy. The idea behind a universal vaccine is that we find a part of the virus called the stalk that doesn't mutate. Okay? So NIH is putting $140 million into basically a crash priority program to develop the vaccine. In the first phase, it's only going to protect against influenza A, not B, viruses. But A is the primary one that sickens and kills. And the idea is to protect greater than 75% of people for at least 12 months and move that out to 10 years.
Oh, wouldn't that be good?
How many people died last year because of the flu?
90,000.
Wow.
All right, Dr. Greg Poland, infectious disease specialist and a vaccine expert. Lots of valuable information from one of the world's best. Well, what have we learned today? Well, there's no Lyme disease vaccine. There is for your dog, but not for you or your children yet. So you need to be tick smart this summer. Make sure your vaccinations are up to date, especially if you are a seasoned citizen. Your immune system isn't quite as good as it used to be. The HPV vaccine, it is a cancer vaccine. And we also learned that 25% of American adults have genital warts. Whew, not good news. And now that vaccine is for some adults up to the age 45. You're supposed to talk to your doctor about that. A universal flu vaccine is now in clinical trials. Nice, one and done. Wouldn't that be great?
Yeah.
And heading into the new school year, the measles outbreak is far from over.
Yeah.
Dr. Greg Poland, infectious disease specialist, thanks so much for being with us.
My pleasure.
Always good to have you.
Thanks.